Okay, is that any better?
Yes.
Yes.
Okay. Woohoo. Okay. I'm on two screens in like a computer plus an extra screen, and I think that just messed it up. But anyway, let's talk about Guam and Chuuk. So if I'm not talking to anthropologists, then the first question I actually usually ask people is, do you know anything about Guam? And that is to sort of get people thinking like, do they actually think about Guam? Have they ever thought about Guam? Because it is such an integral part of the US, and yet uh, typically there are very limited understandings of Guam's connection. So I won't ask you all that because you're anthropologists and you've heard of more things than most. But that's sort of just thinking through like the associations we make with different places. So travel writers write in particular ways about Guam as well. One travel writer wrote that Guam is a place where you mix Texas and Hawaii. She said that in many ways, Guam was a wonderfully unique contradiction. It's a remote island and an international melting pot. It's an American territory and the gateway to Asia. It's home to an intensely local culture, but it's filled with outsiders. And to top it all off, it's just beautiful. And in many ways, this author, this travel writer, is correct. Guam is a web of contradictions, and while it is far away from the mainland, whoops, there we go. Um, as you can see from this map, very far away from the mainland, it is part of the United States. And there are stunning vistas and cliff lines, mountains from old volcanic Pacific islands, just like the travel writer said. And the references to Texas aren't that weird. It's, I remember every New Year's hearing gunshots of celebrations on people's ranches. Trucks and Jeeps are very popular vehicles to get around. People love to convey stickers with American and Guamanian pride and flags. But it's also a Pacific island with a long seafaring tradition. People are very connected to the sea in many, many ways. And there's also beautiful old Catholic churches everywhere because of colonial occupation of Spain for 400 years. And people have really strong family and community ties and village patron saints and have fiestas to honor those village patron saints every year. There's this web of food that connects to all the different colonial histories of Guam, ranging from local kelaguen, which is kind of like a ceviche, to spam musubi coming over from Japan, and Filipino pancit and tortillas from the Spanish days. But these are still just sort of surface images of Guam. And so what I wanted to kind of start with is that these images sort of exoticize Guam from the travel writers. They're consistent in many ways, but they exoticize how remote and far away it is. And they set it apart from the US and downplay why it's a melting pot, which is largely from imperial circumstances. So Guam is the largest island in Micronesia. It has approximately 155,000 residents. It is home to the indigenous Chamorro, who are hypothesized to have arrived from Southeast Asia in about 3500 BP. It's endured 4 centuries of colonization. So the Spanish popped over in the 1600s and 1500s, sorry, and the U.S. took control in 1898 from the Spanish-American War. And with the exception of World War II, when Japan took over, the US has had a pretty consistent presence. Since 1950, after years of the indigenous Chamorro fighting for some autonomy in Guam, it became an unincorporated territory, which means that its residents got US citizenship, but they do not get to vote. And this concept of unincorporated territory gives more autonomy than a possession, but it also indicates that they do not have a path to statehood or independence. So one of Guam's most popular island slogans is "Where America's Day Begins," which evokes this pride and connection to the US. While Guam is part of the US, whenever I discuss my work with mainland US residents, they say, "Where's Guam?" It's it's this faraway sort of military place that people hear about in the news when there's some sort of North Korea threat. Um, This invisibility is intentional. I see it as intentional. It's a common strategy of empire maintenance. it leaves people uncertain of the status of the island. And when we're uncertain of the status of something, we're less concerned about the conditions of that space. So that invisibility or strategically forgetting these bodies allows empires to utilize colonial outposts such as Guam to manage movement of people while securing the mainland. But I was interested in people from Chuuk who moved to Guam. So I need to tell you a little bit about Chuuk too, just a hair. I was specifically interested in people from Chuuk who lived in Guam because I recognized over and over again that Chuukese migrants are treated differently on this colonized island. So I wanted to know how these differences might be embodied in their reproductive health outcomes because I'm a medical anthropologist, so I'm always looking at health outcomes and how they manifest social phenomena. So where is Chuuk? Chuuk is one of the 4 states of the Federated States of Micronesia, a small islands nation that was believed to be inhabited around 2000 BP. Chuuk has been tied to the US since the end of World War II. It became a United Nations Strategic Trust Territory under US control, and it was in each of these districts was its own part of the territory. The FSM gained independence as 4 of those districts, actually 3 of those districts, but 4 islands gained independence together and went into compact of free association with the US in 1986. So I call that the COFA. The COFA is an agreement that provides US financial and logistical support for this nation in exchange for complete control over 1 million square miles of ocean. So military control of all of Micronesia. The FSM and especially Chuuk suffer endemic poverty, however, a deteriorating healthcare infrastructure, a failing education system, and virtually no economic opportunities for residents. So the Compact of Free Association is supposed to provide all of those things, but they're always provided at levels low enough to where they can't ever really sort of get a leg up in terms of true functioning independent nation. This is largely the result of imperial circumstances facilitating this agreement and what I call the politics of benign neglect. For these reasons, many Chuukese citizens leave the state for other settings in search of improved access to education, higher biomedical care, higher tech biomedical care, health, and jobs, of course. Chuukese citizens can leave Chuuk because of a stipulation in this agreement that actually enables the mobility of citizens from the Federated States of Micronesia, as well as those other nations that went into compact of free association with the US. They can travel to the US anytime and just fill out an I-94 form, no visa required, no like planning ahead, and they can live, work, go to school in the US. So it's sort of unfettered access with a category of non-immigrants. So they have this ease of entry, but they are never on the path to citizenship. And so they're kind of this in-between status that's not really becoming part of the US, but also not struggling to get into the US with this flexible mobility. This flexible mobility did enable a mass exodus to the US in the 1980s, and it's continuing today. And Guam is the first stop on the United Airlines island hopper. And so that's where people from Chuuk went to begin with. People from the Marshall Islands were more likely to go to Hawaii at first. Now, people have spread out. They're all over the US now, but there's still a huge contingent of the Chuukese community in Guam. And that is partly because of the one flight that goes through all of these islands and that just sort of influenced migration patterns. So as more and more people moved into Guam, the Chuukese now constitute 7% of Guam's overall population. And they're not the only ones who migrate into Guam. So like the slogan where America's Day begins, American territories in the Pacific also begin in Guam for migrants. So one way in which the US has utilized Guam over the years is as a migration outpost. They have processed migrants from wars, they have processed migrants from conflict, they have processed migrants from COFA agreements all through Guam. Because of this, all this imperially authorized migration, the indigenous Chamorro population is now just 37% of the island. And that also means that there's a lot of tension between the indigenous community and the many migrants from various groups that move into Guam. The Chuukese are definitely the focal point here, though. So while each affected jurisdiction has had some negative reaction to all COFA migrants, the Chuukese are the focal point of the rhetoric in Guam. Resentment and discrimination toward COFA migrants has taken many forms. Anti-immigrant sentiment consistently focuses on blaming indigent COFA migrants for budget shortfalls in health, education, hospital, and housing services. And because of the lack of infrastructure in the Federated States of Micronesia, and particularly in Chuuk, places like Guam and Hawaii become catchment areas for health issues. They're often avoiding, in this case, Chuukese Hospital and the people I worked with, because it was women's reproductive health stuff. Women were often coming up to Guam to give birth because this is where they would give birth if they were in Chuuk, and they didn't feel safe there. Chuukese Hospital is a place characterized by a shortage of staff and supplies. It's dirty. There are cats that keep the patients up all nights chasing the rats that have like open access to everywhere, and there's no running water. So, as a result of what's the hospital setting is like in Chuuk, if families can cobble together a one-way ticket to Guam for a pregnant person and their family, they do it. So Nellie, one participant said, it's a really big difference. Healthcare here in Guam, it's really very good. There's nothing I can compare to the one in Chuuk. But I was interested in this community because their health outcomes, reproductive health outcomes, were so bad compared to everybody else in Guam. So people are moving to Guam, or at least traveling to Guam, to seek better health care and still suffering disproportionate health outcomes. Here are just a few factoids about disproportionate health outcomes. Chuukese women are 9% of women of childbearing age in Guam, but represent 54% of those who have not had prenatal care. They suffer disproportionately high infant mortality, maternal mortality, gestational diabetes, C-sections, and sexually transmitted infections. So I wanted to know why these women face such reproductive health inequities in the very place that they traveled to seek improved care. And this is sort of how I got into this project. So this book draws on 9 years of research in Guam and Chuuk. It started with a multi-sided dissertation research in 2011. And when I finished my dissertation, I conducted follow-up studies for another 5 years on different pieces of the sort of puzzle of Chuukese women living in Guam. This was an ethnography of both the community and the clinic. So I did clinical ethnography following people around basically for 3 days a week for about a year. Community ethnography was more varied, going to various organizations for Chuukese migrants, going down to Chuuk and working with people who work with Chuukese migrants moving back and forth. It was sort of all over the place, getting to know what life was like moving back and forth. So I sought to learn how U.S. imperialism shaped cultural narratives about the movement of Micronesian peoples, discourses about gender and reproduction, healthcare experiences in Guam, and ultimately how all of these layers of social life stratified Chuukese women's reproductive health. So social narratives about who is reproducing reinforce ideas about who deserves to reproduce. The concept of stratified reproduction illuminates how inequities and the unequal distribution of power shape the reproductive lives differently among desirable and undesirable groups. It demonstrates how reproduction differs according to inequalities of race, class, ethnicity, gender, place in the global economy, and migrant status. The concept of stratified reproduction reflects the circumstances shaping Chuukese women's experiences as they migrate to and reside from Guam. So this is one of my theoretical influences. Another one is structural vulnerability. This includes the political and economic vulnerability created by conditions of structural violence, but also integrates social and cultural norms that reinforce inequities and reflect symbolic violence. So a person's vulnerability is not only because of class oppression, economic exploitation, and other forms of structural violence, but also their position in the social order in a hierarchy of various power relationships of race, gender, sexuality, and migrant status, or symbolic violence. Vulnerabilities at the structural, social, symbolic, and also individual and experiential levels are approached as operating together to shape a person's health. I am also informed by an approach in the region. Robert Kist called what the United States did to this region benign neglect. And this is a well-known strategy of American imperial management in Micronesia. While Micronesia is routinely embroiled in U.S. political interests, the body politic of these nations and territories are expendable or forgotten. They are neglected. By using the term politics of benign neglect, I'm referring to the intentional forgetting of the body politic, the political maneuvering in which these bodies are both forgotten and hyper-visible depending on the need, and the resulting imprint on physical bodies in the everyday lives as a result. The reflection of this slow, limited attention and its structural and social impacts on bodies is what I argue renders these bodies vulnerable to poor reproductive health outcomes. So I'm going to sort of piece it together in sort of the layers of structural vulnerability. So talk a little bit about structure first, and then more clinical spaces, symbolic, and then individual experiences, even though it's all enmeshed, as you all know. It's hard to separate out. So the role of the U.S. imperial project in shaping Micronesian colonial history is long and insidious, and it reflects how empires maintain sovereignty through controlling colonial outposts. Micronesia's colonial history also shaped social and economic conditions and relationships between islanders from different islands. I explore the historical and contemporary colonial settings of Guam in this book and in Chuuk, and the role of each empire in shaping the lives of Micronesians, but also shaping ideas about gender, because ideas about gender very much shape ideas about reproductive health or outcomes related to reproductive health. I follow scholars like Ann Stoler, who have been telling us that the study of sexuality is a discourse for empire, particularly in U.S. imperial zones. And I examine the role of U.S. imperialism in creating and exoticizing discourses on Chuukese sexuality and reproduction, as well as contemporary efforts to control it through discourses of development. I consider the role of Christian missions and U.S. patriarchal institutions in reshaping ideas about gender, and specifically ideas about reproduction and sexuality. I also examine the role of anthropologists of my predecessors in the 1940s, contributing to the imperial project and the colonizing history of our discipline. Anthropologists' depictions of Chuukese sexuality in the 1940s and 50s during the Trust Territory days is reviewed in my book and critiqued for exoticizing ramifications and the role in colonizing Chuuk. So some of our predecessors wrote guides for the Navy to sort of manage the population. Communities negotiate and adopt or reject new ideas about gender, though. They don't just always adopt them. So these are important to think about, but it's also important to give Chuukese women autonomy and recognize that they adopted and rejected discourses as they saw fit. But gender inequities that have many of which, not all, but some of which have been imported, absolutely shape women's decisions to move from Chuuk and shape their everyday lives in Guam. And then what happens once they get there? So drawing on multiple women's accounts, I describe Chuukese women's experiences once they arrive in Guam. Chuukese women encounter anti-immigrant sentiment and social exclusion that mirror those which prevail in the U.S. So with very poor health outcomes, the Chuukese represent a political and social body of invaders who bring sickness, babies, and increased costs to the Guam government without adequate compensation by their colonizer, which sanctions all this migration. Chuukese people are always in Guam newspapers for being accused of costing money through their use of Guam's education and health systems, and it is alleged by committing crimes. This is quite gendered, as when it comes to women, they are given pejorative monikers in the U.S. rhetoric, like anchor babies and welfare queens. This one passage is pretty telling. So the then director of the Department of Public Health and Social Services was asked about intentions for women from different groups coming to Guam to get birth. And when asked about intentions from South Korean women, he said, "I think typically what you'll find is that mothers coming from Korea give birth here and obtain a social security number and a passport for their child. They're thinking that 20 or 30 years later, their child can return to the US and go to school." With mothers from the freely associated states, which is another way of saying the COFA countries, the desire is that their child will qualify for welfare programs and other benefits that they don't have access to. So even the director of the Department of Social Services perceives these migrant groups as having very, very different intentions for coming to give birth in Guam. And that reverberates everywhere in social services, in clinical spaces, in public discourse. And the resentment and discrimination definitely is shaped by this idea. So Guam has the best biomedical healthcare in Micronesia. It spends, as of the last estimate, 13 times what Chuuk does on healthcare per capita. I think that's a lot more, but I haven't seen a number come recently on what Chuuk is spending these days. But despite Guam's superior care compared to Chuuk, it is much in need of improvement. The healthcare system is substandard compared to what we expect in a US space. Both hospitals open to civilians, one public and one private, regularly report nursing vacancies from 20 to 40%, with over 100 registered nurse positions available between the two facilities at any given time. The only public hospital, Guam Memorial Hospital, experiences profound problems, including inadequate staffing and space, a crumbling physical infrastructure, and massive debt. This is one headline that was fairly recent: fire in cafeteria, waterfalls in the elevators, snakes in the ceiling. GMH, Guam Memorial Hospital, won't survive another storm. Interestingly, it sits on this cliff overlooking the Philippine Sea. It's this gorgeous cliff where there's $1 million homes everywhere, and Tumon, which is dubbed Little Waikiki, the big tourist area, is right down the street. But it is an old, crumbling building. When you park there and walk in, escaping Guam's inevitable heat, you always encounter some sort of construction, but it never really makes much of a difference. At all times, some part of this decaying building is getting a facelift, and it's the only place where women can birth. The private hospital did births for about 6 months and then said they weren't doing them anymore. And so it all goes through the public hospital. So the duality of being one of the best health systems in Micronesia and one of the worst in the US is a product of Guam's unique position in the US and Micronesian political landscape. The benign neglect and resulting deteriorating healthcare system of Chuuk motivate women to come to Guam, but once they arrive, they face these new structural, social, and individual constraints that inhibit their care. So the hospital is a challenge, but what about before the hospital? What about getting that prenatal care, or in some circumstances, family planning? Although the large majority of people I spoke with, it was about prenatal care. So they typically speak about that specifically. So first they struggle with getting into these clinics. You're not allowed to walk in if you don't have an appointment. You can see the stop and wait sign. There's no online way of making an appointment, and you can't get nobody ever answers the phone. So it's really, really hard to get in. It actually took me about 9 months to get in, just to start doing ethnography in there. And the only reason that it happened after 9 months of me trying to get through is because I found out that somebody I knew at the Department of Public Health knew the director of the community health clinic. And so it was a sort of a back connection. So Chuukese women do eventually get in, but it's really, really hard. And that's once you have insurance coverage. If you don't have insurance coverage, you can still see a physician. They will check the growth of the fetus, but they will not do any labs without insurance coverage, which is a whole nother beast. So Chuukese women struggle to communicate their needs. They struggle to get insurance, then they struggle to get an appointment. It's really hard to get access without a car. The buses are very unreliable in Guam. And then once they finally get there, they're often rushed through. There's power language differences and just a chaotic environment. And I felt it was chaotic myself, and struggled to sort of manage the chaos on a regular basis. In addition, anti-immigrant discourses operate in these spaces. So symbolic manifestations of Chuukese women's bodies, talking about their clothing, their betel nut chewing, their hyperfertility, are the focus of conversations among healthcare workers who frequently express frustration at having to serve this group. Even healthcare workers with the best intentions often discuss Chuukese culture as different, negatively impacting their care. They often reference women's shyness with providers and their male partners' excessive number of sexual partners as explaining all of women's outcomes. So hearing these narratives, I was just curious, like how much of their cultural norms actually shaped their health? Excuse me. And how much of this was just culturalist racism? So within the Chuukese transmigrant community, the terms culture and custom are used quite frequently to specifically refer to traditions that differentiate them from other Guam residents. Chuukese community is not alone in constructing these notions of culture. The Chamorro often construct Americanness in opposition to said cultural migrants. That's why it wasn't surprising when I was told by Sierra, people just don't like us because we actually bring our culture with us here. What I ultimately saw in the clinics was that inequalities and hierarchies in Guam society were actually reproduced in the clinic. So the most vulnerable group in Guam were Micronesians, and they barely got jobs there, if at all. The next most vulnerable group were indigenous Chamorro women of Guam, who often occupied the lowest social position at the clinic, front desk, and had the lowest pay. Their jobs were menial, repetitive, and they felt frustrated and unappreciated by other people in the clinics. They were also often cold and mean toward patients. Then most of the nurse aides and nurses were Filipina, and they were a bit more cheerful, but also made fun of patients to their face. And then there were the physicians, which were largely white and male, and some male Chamorros from more elite families. With some exceptions, the providers actually provided care pretty nicely. As Kayleen, one participant, explained to me, if you just get past that front desk, you start getting treated like a human. So a few clinic and hospital ethnographers have focused on these hierarchies and stratified care in clinics and argued that in this environment, poor treatment by the low-level workers may be how these powerless employees can assert their power to the only actors who have less power than them, in this case, the mostly migrant population. Excuse me. So kind of going back to the clinics blame culture, the community blames the clinics for their bad experiences. What can I tell you about ideas about reproduction in Chuukese cultural norms and gender? So Chuukese women's reproductive bodies are not just shaped by migration and hostility, they're also shaped by ideas about women and gender. Chuukese communities have a clan-based matrilineal structure, and reproduction signifies perpetuating the clan and heirs for the land. This means reproduction can give women power or enhance their status as children to ensure survival of the clan and its land. Pregnancy is a time when women are indulged and pampered if they get pregnant the way that the church tells them to get pregnant. I won't call it the right way because that's the right way only in the eyes of the church. So it can also be disempowering if women get pregnant in other ways. Powerlessness often takes the form of stigma and shame. So I consider women's reproductive life histories to elucidate the role of stigma and shame, and how this controls their sexuality and how this controls women's reproduction. I explore lessons on sexual purity that women receive around the time of puberty and consider how those lessons shape their entire sexual lives. I consider how the symbolic value of children and socially sanctioned pregnancies matter to women who were taught to get pregnant in a particular way and then show strength and silence and power through that birthing process. The connections between land and mothering as a powerful source of women's strength in Chuuk, but that could be lost as they migrate and are no longer on their land or sort of holding their land with their children. So pregnancy and birth are just one piece of study of reproduction. I also expand on the ways in which women can control their own reproduction and negotiate intimate relationships. First, I describe women's knowledge, access, and experiences of trying to plan their families. These plans are often made in conjunction with or completely by their intimate heterosexual partners. Such relationships do reflect cultural constructions of the social hierarchy of gender, elucidating inequities in power and control over women's bodies. I illustrate this by discussing an attempted abortion by one participant, a sexually transmitted infection that came through a husband's extramarital partner, and trauma from marital sexual violence. The stories that attend to some of like attend to some of the risks that women face in terms of their reproductive health outcomes, and it structures those poor outcomes in Guam as well. Women also sort of pushed back, though. They reflected on their experiences as women, having to be perfect in every way, like Jasmine. She said they expect women to be as perfect as can be. But I don't know, the way my mom taught us is yes, men are allowed in our culture to do all the mistakes, but women are supposed to be very submissive and obedient and a perfect feature. But as you know, life is not perfect. So this book examines the intersection of Chuukese transnational women's reproductive experiences and individual vulnerabilities in imperial spaces which neglect them, the symbolic representations of their reproductive bodies in society, including xenophobia and gender inequality, and the control and movement of their bodies through structural violence and imperial citizenship, capitalist exploitation, and the biomedical management of health. Each of these layers makes them vulnerable to those poor reproductive health outcomes I mentioned in the beginning. But women resist. They have enduring strength in multiple forms of resistance. Despite the confines of these structural, social, symbolic, and individual constraints, women's agency to change their lives is evident everywhere. Grassroots organizations in Chuuk and Guam counteract anti-immigrant sentiment and gender inequities. And through social support, they work to redefine narratives about Chuukese communities. They also contribute to changing laws reflecting gender and sexual inequities, circumvent failing health systems, and foster new creative means to get women and families access to care. Women's and community groups have been at the forefront of activist work in both island jurisdictions. And so, yes, Chuukese women are suffering the effects of imperialism in communities, clinics, and families, but they also have a lot of power to resist such effects and are constantly working to improve their circumstances. And here's just one flyer of an example, a more recent example. Nobody could get access to the Chuukese community in Guam during the pandemic to get vaccines out, and it was a Chuukese women's group who brought everybody in. So this is just a flyer reflecting that. And that is where I'm going to end. So I would love to hear all your questions. I'll close out the slide first. Oops. You're on mute, Tim.
Thank you. As I said, we typically have some question and answer at this time, and I'm sure that you guys have some questions. I know that Rick is going to have some comments, but Phil, did you want to say something?
I'd like to ask Sarah how she got interested in Chuuk in the first place.
That's a really good question. So I did have a family member out in Micronesia, but not in Chuuk. So I was familiar with the region as a child, but I actually started getting really interested in U.S. imperialism in grad school, and I was kind of looking around for communities very much affected by U.S. imperialism, and so I started actually just looking at the data, and Chuukese people were suffering the most. So that's sort of how I got in there. And then I got in touch with Mac Marshall, who kind of mentored me through that because he worked in Chuuk for decades.
Okay, thanks.
Yeah.
Well, I'm kind of interested in the idea of U.S. imperialism, and you know you've brought that up, and can you talk a little bit more about U.S. imperialism and how you see it, how how big it is, what are the key issues, and so forth.
Sure. There's this whole literature on neo-imperialism or neo-colonialism that talks about the different ways in which imperialism is now shaped. But sometimes that just sort of detracts from the fact that imperialism is imperialism. Big countries taking over all kinds of other spaces and deciding what's going to happen in those spaces is still big countries taking over. So while U.S. imperialism is a little bit different than, say, what we saw before World War II, it's not that different. They take possessions, they militarize those spaces, and they make sure that those spaces do not have the political power to kick out the military. And they keep it as quiet as possible in places like Guam so that the mainland does not get interested. And more recently, there has been a little bit more movement in the compact countries as well, because that's another manifestation of U.S. imperialism. If we, and by we I mean U.S. citizens, so if the U.S. government gives a bunch of money for a place to survive in exchange for military control of their spaces, and that group cannot really survive without that compact agreement, do they really have true independence? I would argue no. So that's a different manifestation of imperialism, where it's like, sure, you can make your own laws, but when we need your space, we're just going to come take over. And if you say no to something, then we'll just take money away that you need to survive.
Okay, that's a good beginning, but I think there's, well, I mean, when you talk about U.S. imperialism, are you also including Puerto Rico, for example, the Caribbean area, I think U.S. Virgin Islands and so forth. But we don't have military bases in all of those places. We do in Puerto Rico, but I don't know about the U.S. Virgin Islands.
We don't, but we do manage migration in all of those spaces. And a lot of it's really quiet. So it's not always sort of public record how movement is happening, but it does tend to be in islands that are somehow under US control, which is kind of an interesting manifestation of power.
Okay, good. Suzanne?
Thank you for the talk, Sarah. I'm curious about what you said about the right and wrong way to reproduce. According to the church, there's a certain ideal, but I'd like to know what the other concepts are that you referred to.
Yeah, great question. So the very oldest ethnographic literature, and actually sometimes not ethnographic, sometimes it was missionary literature on Chuuk, talked about sex parties, which I feel like I struggle with that because it was written by missionaries judging them. So maybe not sex parties, maybe sex parties, whatever. But either way, in the matrilineal clan structure, women had partners when it made sense. Babies belonged to their family, so when it didn't make sense, go find another one. The male that was sort of the powerful partner in their life for life decisions was a brother. And
yeah.
So sex just wasn't perceived, as we know. I mean, this is all written by outsiders. What we know is that it was, or what we think is that it was just sex wasn't a big deal until the missionaries came. And then sex was a big deal, and it was women's fault when it happened outside of the rules of hetero marriage. And so what sort of ultimately happened is that people still have sexual relations outside of marriage, but when they're caught, only the women struggle with the consequences from the family.
Does everybody get married now?
Marriage is expected, yeah. And so people will get, and oftentimes young women do get pregnant before marriage. You're not allowed to talk about sex. You're not allowed to talk about even dating. Like that's not a thing. You have to sneak off. And so unintended pregnancy, of course, is a big deal, because who can get access to birth control if you know that somebody's auntie works in the one place you can get access to birth control, and somebody's going to find out you're asking about it. So then that pregnancy either leads to shaming and marriage if the male is willing to do that, shaming and sometimes physical violence or running away to family in Guam if the male is not willing, or quickly getting married before anybody finds out.
Is it the Catholic Church? The church?
No, yes, 50% Catholic, 50% Protestant, so no and yes. There's also Mormons out there and SDA. And Protestants, just like the generalist Protestant, there's not, the Episcopal Church isn't out there. It's just the Protestants.
Herb, do you have a question?
Yeah, I noticed you put up a picture of the Keist and Marshall book, and you mentioned anthropology and colonialism, but you didn't really say anything about it. And I'm just wondering, do you have some specifics about harm done or things like that with anthropologists and colonialism?
Yeah, so the largest applied anthropology project funded by the US government was actually in Micronesia. It's called the Micronesian, I'm gonna mess up the acronym right now, Micronesian something, SEMA. It was like the Coordinated Investigation of Micronesian Anthropology. There we go. I'm having some recall issues right now with words, but it was this huge project that brought out lots of anthropologists, also other kinds of scholars, to study and investigate all of these islands to understand whether they were suited, and the wording is kind of challenging, but like suited for independence. But while the Navy is saying kind of like wink, wink, but we want them. So you don't have to say they're suited for independence. So the anthropologists involved, some of them are like theoretical forefathers, and what they said wasn't really necessarily super problematic in terms of over sexualizing women, but there were a few that said things like Chuukese women are both stupid and manipulative. And wrote pages and pages about Chuukese women's vaginas. And that's the kind of stuff where I find problematic that that our theoretical forefathers were. It was also, there were a couple of married couples out there, but this is the 1940s. The women weren't necessarily with degrees, and a lot of the writing was written from the male perspective because the male anthropologists were interviewing males about women. So concepts like women are stupid and manipulative were likely coming from male voices, but it got into books, and it also got into sort of the narrative that, because it matched the US patriarchal ideas about, and church ideas about men should be in charge, nuclear families are better, shame should be associated with sexuality, that sort of thing. But not that actual book is just the history. So I'm not blaming them. They're great. They just wrote the whole
As a matter
history.
of fact, as I recall, the Foulgood article in general is very exonerating of anthropologists, and the extent to which anthropologists didn't, many of the important studies, ethnographic studies that were not involved in a colonial government at all. And in other cases, they usually quit rather fast because they couldn't stand working with the government. And there's quite, it sounds to me like you're sort of overgeneralizing the harm that was done and the extent to which this is colonialism, rather than something that you don't happen to approve of in their analysis. There's a big difference between colonialism and getting something wrong.
Yeah, and being paid by the Navy to do your work. But I welcome you to read the whole chapter, because it's hard to do anything but overgeneralize when we speak about something for just a few minutes. I have a whole chapter on this stuff, and you know what? There were some really great anthropologists in that moment too. So it talks about that as well.
Rick, and then Alice. Rick, and then Alice.
Yeah, Sarah, I'm delighted to meet you. I'd love to have a chance to have some additional conversation after this is over. But just a few thoughts. One, you mentioned Mac Marshall. How did you know him?
I cold called him, as one would say. I emailed him when I was a grad student, like curious about this stuff, because all of my advisors, I was in Florida, they were like, we don't know anything about this region. What are you doing? And I didn't expect a response, and he responded, with a 4-page email, and we started a very long relationship after that. He became one of my primary advisors. Has phenomenal mentor, and all, like while retired or semi-retired at the beginning and then retired. So I met him by just randomly emailing him and hoping that I heard back. And luckily he was very generous with his knowledge and time.
Yeah, he is. I don't know if you've been in contact with him recently, but by coincidence, I just exchanged a couple of emails, maybe a half hour before the session started, and you probably should know that he recently had a serious car accident.
I saw that. Yeah.
He's recuperating. The car is totaled, and his partner has a fractured neck. So if you're good friends with him, you might want
I
to.
need to reach out. Okay.
So,
Thank you. Yeah, I
Um,
haven't spoken to him since the book came out when I, sent him the book and was like, thank you for everything. So I need to reach out.
yeah, I'm wondering, you talk a lot about Chuukese on Guam. I imagine that you did your field work primarily on Guam. Did you spend time in Chuuk as well?
I did, but a lot less time. I basically would spend my summers there so that I could remain employed at University of Guam during the regular year, logistics of paying your bills while also doing field work.
Hmm.
So I'd go down. One summer I went down for 3 months, and then each summer after that it was more like 3 weeks, and I would work with the Chuuk Women's Council. And so they would sort of Kiki Stinnett, may she rest in peace, ran the Chuuk Women's Council and was kind of known as a pretty awesome Pacific woman who did all kinds of cool stuff and moved mountains. She kind of took me under her wing and mothered me in that space.
I'm also wondering if you've been involved at all with the Association for Social Anthropology in Oceania.
Yes, that's how I know who you are. But I guess I'm more of a lurker, a quiet lurker. Yes, I've been to a couple of the conferences, but it's been a while, just because of funding. So I went to the last virtual one because it's a lot
Mhm.
easier and cheaper to do. But I did not get to go to all the way out there this year.
Yeah, it's a really great organization, and it's extraordinarily supportive. If I imagine that you're on the listserv, which is no longer officially ASAO net, but
Deja.
if if anyone has a question, they post it on the listserv, and within minutes there are multiple informative answers. So I'm glad to know that you're involved with ASAO, which is different from ASA, and that
Yeah.
can be a little confusing.
Yes. I think Matt got me onto ASAO too, and I love the listserv.
He was very heavily involved with ASAO for a long time. I see that there are a couple of other hands up, so I should probably shut up for a while and turn the mic over to somebody else.
Okay, Alice and then Margot.
I want to basically jump off of Herb. And I was there at Harvard in the late 50s, which was the height of the decade. It was the decade of the 50s, not the 40s were recovering from what are we going to do with all these guys now out of uniform. The 50s was when Douglas Oliver was funding and directing all the men grad students in cultural anthropology at Harvard to get well funded and closely directed dissertation field research positions in the trust territories. No women were invited at all, so far as I am aware. Of course, I wasn't a cultural anthropology specialist anyways, but I'm pretty sure it was a gender thing. I mean, I know all the women in my cohort. We were totally ignored. It was also very obvious because I was married to a working class guy, one of our closest friends. He was a working class guy. And then there was Dave Gradville, who was Jewish. Yeah, they were looking for WASP men. And these WASP men were offered these very good dissertation research stations and assured of being mentored by Oliver to get their PhDs, and then presumably he would get them jobs. So there were a number of very well-known anthropologists, and the principal one to look at was David Snyder, because of his book many years later about his experience in that project on YAP, where Snyder is so clear about a formula was presented to them. These are primitive people. They are primitive agriculturalist fishermen. They all have clans. They have clan territories. Clan territories. The land, map the land in each clan's territory. And it's so blatantly obvious, the whole point. Map the districts and the local authorities in the local districts so that indirect rule can be imposed upon these islands. And of course, in Snyder's book, he emphasizes Yap had no clans. Yap people were very clear. They had no clans. There were no clan territories. Oliver was insistent that Snyder, and presumably the other men who didn't write such a book, map clan territories so that the Navy, the government, could have maps and impose the whole governmental structure, which in terms of the history of anthropology means that so much of these data in these classic ethnographies of Micronesia can be assumed to be full of false information. In other words, I'm glad I'm not working in that area. I'm glad that Northern Plains of North America, I have some more firm data to work on. At any rate, Oliver himself was a very dominating professor. He was a senior professor. He was very dominating. It was Oliver's dominating insistence on control and rule that cost my husband his PhD. So hardly anybody knows my husband was ABD. And he was ABD because in the generals, where there was a representative of each of the four areas, and then our major professor, who was low status, and Oliver represented cultural anthropology, and there was this list of 100 books you had to read. So Oliver asked my husband, who at that point is professionally employed full-time as provincial archaeologist in Saskatchewan, already has some papers out and so on. Tell me, in African Systems of Kinship and Marriage by Evans, Pritchard, and Fortes, blah, 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 a very particular question. Now, in the first place, many years later, African Systems of Kinship and Marriage has been absolutely trashed by the Africanist. Aside from that, my husband answered, I didn't read that book. I will answer any questions you have about North American systems of kinship and marriage, such as Robert Lowy's Grow Kinship. Tom didn't mention Lewis Henry Morgan, kinship structures, which he should have, but it just didn't quite occur to him. And Oliver said, you were required to read that book. You are required to answer questions related to that book. All right. We will stop now. We will reconvene in 10 days when you have read that book, and then you will answer questions on it. And Tom said, I'm sorry, I have a full-time job as provincial archaeologist in Saskatchewan, and I do not have time to read that book. Just ask me about North America. So I was outside the door, there was banging on the table, there was shouting, then all of a sudden, 4 men came out, angry, talking to each other angrily, because the other 3 did not approve of Oliver's insistence on blatant control of the students. So that's from History of Anthropology. I'm a informant from the territory.
Wow,
Thank you.
thanks for,
Thank you for sharing.
yeah.
Sorry. Good.
Margot. You're muted, Margot. Yeah. Yeah, okay.
Okay. Some of your comments related to um, uh, insurance during pregnancy and that a lot of people don't have it. So I was wondering, what do they, how does that system work? Here, most of us get our health insurance through our employment. Is that also true in Guam? And is it the woman's health insurance, or is it her partner's health insurance, or uh, what would be some ways to get more people covered by health insurance to improve their health care?
That's a really good question. And it's a huge portion of the book too, because it's super complex. But the majority of so when I was in that space, well, up until 2 years ago, Chuukese women that came from Chuuk pregnant would get on a special federal program. It's called the MCH program, Maternal Child Health Program, where they would get like 6 prenatal visits, a couple of labs, and their birth covered. Chuukese women who are born in Guam, they have access to Medicaid if they meet the income requirements, which most Chuukese women do. Most of Guam meets the income requirements because the cost, that even getting paid by the government of Guam is pretty low. But it's just like a state in most ways. There's private insurance for people with jobs that cover that insurance. There's Medicaid and Medicare. The difference is that there are caps. So how much Medicaid spending can happen is capped in territories, and it's not capped in states. And so they hit the ceiling every year, and then the hospital can't get any more money, even if more people have birthed or gotten other kinds of treatment. And that's part of why they're always broke. But so what's changed? Just I think it's probably 2 years ago now. So in 1986, when the Compact of Free Association was negotiated, non-immigrants got access to food stamps, they got access to Medicaid and Medicare, they got access to Social Security, like all the resources. And then the Welfare to Work Act inadvertently took it away from them because nobody thought about the 100,000 Micronesians out there. Or maybe they did, and maybe it was insidious. I don't know, but they claim they didn't know about it. And so 20 years of trying to get them put back on all of those services finally worked a couple of years ago during COVID. But they had been taken off for all of those years just because the act said that you had to be a resident for 5 years, like a migrant for 5 years. And they never were established as residents because they're non-immigrants. So they could never get that established role. It was, I think, really just an oversight. And during the COVID pandemic, so probably, I guess, more like 3 to 4 years ago, that finally got reversed, and they have access to Medicaid, Medicare, food stamps, Social Security again.
At least until the current administration does
Yeah.
something.
Has
Yeah.
Doge gone to Micronesia, or has Doge neglected Micronesia. They haven't noticed it either.
To, to my knowledge, their invisibility is a benefit right now. I haven't heard, we don't know what all Doge is doing, but no, I haven't heard any specifics except like this woman who runs the Chuuk women's group in Guam. She was doing a Micronesian women's forum there, and she had to call it a Micronesian forum there because it was federally funded money and women wasn't allowed to be in there anymore. So she like planned the whole thing before, mostly in the fall, and then but it was happening in March, and she had to change all the language. And I actually have a NIH grant that is also going through that situation right now. So hopefully I don't alert Doge to Micronesia because of that grant. Because that, yeah, it could be rough. But I did get I got a notice that I have DEI in my grant, and that it needs to be taken out if I want it to be funded. And that was all. It was 2 sentences, so I can't elaborate because I didn't get any extra details.
Who did the notice come from?
Somebody at NIH that was not listed as my program officer or scientific officer, but they had an NIH address.
But you can't find a name?
It actually didn't even come to me. It came to our grants officer who was told to tell me and that I would need to change my whole grant in 48 hours.
People
So I
who
have a name, but I don't know who the
are
person is.
doing illegal things.
Yeah.
Alice, go ahead.
I just wanted to mention that I was researching years ago about the whole takeover of First Nations lands. And I think it was in that classic book by Weinberg on the imperialism. And during the time of the Spanish-American War in 1898, when the US government was gung-ho to do battle, not only in the Caribbean, but also out in the Philippine Sea. And at that point, one congressman stood up in Congress and said, this is unconstitutional. It says very clearly in the Constitution that the United States troops are to defend the implied existing territory of the United States in North America. Doesn't quite say it, simply United States territory. And there's one congressman said, in no way can the Philippines be considered to be part of US territory to be defended. And nobody else in Congress in 1898 would follow the Constitution. That's so clear.
Okay. You're just a font of wisdom and knowledge. Gosh, it's great, Alice, to hear that story. Is there anybody else, or we'll start bringing things to an end today? I don't know, Rick, if you had one last comment to make.
Well, it's just really nice for me to have a chance to communicate with somebody else who has spent time in well, I was going to say Southwestern Pacific, but for you, I guess it's the Northwestern Pacific. We hope that we have more of an opportunity to exchange ideas. I assume that I can find your email address through SUNY. That's Westport.
Westbury.
Westbury, but I can also just put it in the chat.
Yeah, okay, great. When I was a kid, my best friend, his family had horses that they kept in Westbury. So that's what I think of when I think of that area. But Yeah, that's great. I really appreciate your contributions and your really focusing on an aspect of relationships within Micronesia that I hadn't tuned into before. The relationships among different groups within Micronesia and some of the gender-based issues that you brought up, which I think are important. So thank you.
Thank you.
Yeah, I think this is something that we well, I knew nothing about it. And so you really brought a lot of very important information to us. And your theoretical perspectives and everything are really, really important. So I hope you get that grant and hope you can continue to go back and do work there. Are you going to be working in this area for the rest of your life like Rick did and is still involved in?
Well, no, the grant actually was, so I was working with the Chuukese Women's Organization, and I was like, what do y'all want to do? Like, what is interesting to you? What is meaningful to you? And so the grant was based on their interests. And if that keeps happening, I'm gonna keep working there and be like, I can share my skills while you kind of drive the project. But I'm also starting to investigate some patient provider stuff in the entire US around endometriosis and some other invisible reproductive pain issues. And that's been pretty fascinating so far too. So, but I am just stepping my toe into that one. So that's brand new. I don't have much to say on it besides I'm fascinated. I also want to thank Alice. That's so cool to hear about Oliver. I mean, not cool that he wasn't the greatest advisor, but it's just really great to hear, a perspective from somebody who was there in the moment.
I want to thank you too, Sarah. I'm sorry I came in a little bit late, but I used to teach anthropology of gender and other things, and I would start class out by talking about empire and saying the important question to ask when dealing with empire is who is doing what to whose body. And so feminism, gender studies are key, I think, to understanding how empire works, and your work would have provided excellent examples in my class of just that thing. So thank you very much for your talk. It was fascinating.
Thank you. And thank you all for your questions. It was really fun to talk anthro stuff and get questions from anthropologists about this stuff. I still have to answer what an anthropologist is pretty regularly at school.
Well, thank you very much, Sarah. One, for coming to the rescue for us and jumping in at the last minute to do our chat for May, and I'm very appreciative of that. But this was really fascinating, and I wish you the very, very best in all of your endeavors, and good luck. And again, hope you'll continue to visit us. Maybe, as I said, I'll put you on the listserv, and you'll hear see some of our discussions that are going on, and receive the invitations to future chats. So thank you very much once again, and a little round of applause for you. And thank you so much. So good luck, and thank you all. Goodbye, everyone, and we'll see you again in August or September. Bye-bye. Have a good
Thank
summer.
you.
Have a good summer,
Bye,
everyone.
everyone.
Bye.
Bye-bye.